Andrew Jennison.
Present.
Benjamin Vitale.
Present.
Grant Kyle.
Here.
Paul Pinkney.
Here.
Aileen McNabb Coleman.
Present.
Joseph DeForest.
Present.
Terrence Baxter.
Aye.
Joseph Bennett.
Here.
Frank Reginelli.
Here.
Patrick Mahoonic.
Here.
Timothy Lattimore.
Here.
Michael Didio.
Here.
Ryan Foley.
Present.
Keith Batman.
Present. Would you rise to the pledge?
I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. So I think the first order on our agenda is a proclamation. So if I could ask Pauline folks to join us up here.
Mr. Didio too, sir.
So, whereas Pauline Coates Johnson is celebrating 90 years of an illustrious life, much of it spent highlighting the legacy of her Aunt Harriet Tubman through various advocacy efforts. And whereas Ms. Coates Johnson was born and raised in Auburn, she was the first African-American telephone operator for New York State Telephone Company in Cayuga County. She's been an active proponent to place Harriet Tubman on the $20 bill. She has been and remains an active member of the NAACP and the Harriet Tubman Booster Club. Whereas she was 26, she discovered she was the great-great-grandniece of Harriet Tubman and has spent the next 60-plus years traveling the U.S. and the world, spreading the news of her aunt's great deeds. Her efforts have not gone unnoticed. She's been honored with the Dr. Martin Luther King Jr. Memorial Award, inducted into the NAACP Hall of Fame, and recognized as a woman of distinction by Senator DeFrancisco. Her passion for preserving the rich history of her family, our community, and creating positive change has earned the respect and affection of all those whom she has come into contact. Now therefore, I, Keith Batman, chair of the Cayuga County Legislature, and fellow legislators do hereby proclaim September 26, 2017 as Pauline Coates Johnson Day, and urge our residents
She also swore me in 4 years ago, so I appreciate that little token. Thank you very much. Let's go this way.
We have two other proclamations that have been or will be delivered later. One is the Kinship Care Month proclamation and the Constitution Week proclamation. So we will not present those tonight. Okay, at this point in our agenda is our public to be heard. I know we have some fellow residents who wish to be heard. And I've asked when you come forward, you state your name, your address, and please limit your comments to 3 minutes or so. After 3 minutes, I'll let you know that 3 minutes is passed, and I'll ask you to wrap up your comments at that point. So, if I may see, who would like to go first? I know there are 3 or 4 individuals.
Mr. Chair,
Yes.
I do have one public to be heard before. I know there's a lot of the nurses here. Kevin Jones is here to speak. He's in my district.
Very good. Is there a reason he needs to go first?
Well, I think it's on
I
a
guess
different
they're not here,
subject.
that's fine.
Different subject.
That's fine. Yeah, come forward, Mr.
Basically,
If you would come up here, please. And
I'd just like to,
I'm sorry, if you could state your name and address for the record.
okay, yeah, my name's Kevin Jones, 4 Tuttle Square, Auburn, New York. And basically why I'm here is like Timmy Lattimore has been working on towards suing the county suing the opioid company, drug companies for the damages that they've done to our county. And basically it's something that they absolutely knew what they were doing when they did this. They had tests and things, you know, surveys, tests. They knew that drugs were addictive. They shoved that under the carpet, didn't want to talk about it, and sold it. Actually went out into the field. They got the Surgeon General to make pain the 5th vital sign so that they could sell more opiates. And more tests came out over and over and over again about how addictive it was. And they make the tobacco companies look like amateurs when it comes to what they did to the United States. And this county, you know, I can't even imagine 85% of the people in the prisons today are drug-related problems that are going on. And just this county alone, what we spend for the jails, what we spend in the hospitals, what we spend in our ERs being clogged up with drug seekers and all that type of stuff. We have a lot of actual, you know, damages that we can put down on a piece of paper, and we can say, this is what you owe us. And there's already states that have already went forward and sued them successfully. So there's no reason that we should be the last one to get involved in this. And I don't see any downside to any of this, you know. And I'd like to see, rather than, if we did get something, rather than buying a bunch of new fire trucks, you know, let's go out and do something about the future problem that we're still having with this, because the numbers, the death rates are still going up. You know, they may not show much on paper because of the way that they're all, you know, the way that they register who dies of what, because there's other drugs in people's system. But the numbers of deaths are still going up, and the costs are still going up. And there's ways around this if we had money to put more money into treatment and prevention and things like that. You know, we could actually start saving the county some money if we put that money aside for that specifically. And that's basically all I wanted to address. I don't see any downside to this, and I hope that you guys get together and you decide to pursue this. Thank you.
Thank you. Again, please state your name and address, and I'll let you know when 3 minutes is up.
Okay. My name is Nancy Benton. I reside on Ira Hill Road in Cato, New York. First, I'd like to say good evening and thank you to Mr. Bateman and the Cayuga County legislators for allowing us to speak tonight on behalf of SEIU 1199 nurses. I've been a registered nurse at Auburn Community Hospital for 30 plus years. I was born and resided in this county my entire life, so this hospital is important to me. I'd like to address that the union has been in contract negotiations with Auburn Community Hospital since June. When we first met at the bargaining table with management, we made it pretty clear that staffing was our main issue and was at the forefront of this contract. Since then, we have met on several occasions with very little movement towards increasing staffing. Documented research has shown that improved patient to nurse ratios have lessened the length of stay in hospitals, reduced medication errors, falls, hospital deaths, and improved patient satisfaction, increased hospital reimbursement, and aided in the retention of bedside nurses, which in itself is costly to a facility to rely on travelers and to orient new staff. Times have changed, the demands on nursing has increased. Patients are sicker, their acuity is higher, electronic charting is more time consuming. And with all this being said, the staffing grids at Auburn Community Hospital have remained unchanged for at least 3 contracts, so that's approximately 10 years. Management response to increasing these is it is too costly. The 1199 nurses feel that with a small adjustment in the grids, our patients' quality of care would be improved, along with the job satisfaction and retention of nurses. Auburn Community Hospital services have also grown, as you have all realized in the newspaper and in our community. Along with this, nursing should parallel that. We at Auburn Community Hospital, the patients and staff are your family, your friends, and your constituents. So at this time, I would ask the legislators for your support as we move forward in our negotiations, and also to support safe staffing patient ratios in the legislation that they're trying to pass today. I'd like to say thank you.
Stand out here. So,
But only if we can make jokes about
go right ahead, go for it. So, my name is Kelly Ruderman, and I'm from Shingle Valley Road in Genoa, New York, from District 8. And I have been a nurse at Auburn Community Hospital for 33 years. I've also been a member of the negotiating committee for the RN union for about 20 years, including the contract when the hospital negotiated the staffing grid that we have right now. The purpose of that grid was to establish minimum numbers of nurses per patients on the floor. And what happened was if the number of nurses fell below the number that was set by the grid, the nurses that were working would receive a premium pay bonus. Now, I worked on that contract. I know that the nurses who worked on that assumed that we would never make that pay, that the hospital would rather be aggressive in recruitment and retention of nurses and build the nursing staff up so that they would never have to pay that, and we would never have to be put in situations where we weren't giving the quality of care that we knew we had to give. Unfortunately, that has not been true. Since the grid has been established, as Nancy said, there's been a dramatic change in the duties of the nurse in the delivery of bedside care. These changes include what Nancy mentioned. If any of you have been in the doctor's office, if you've seen the use of computers and the doc is behind the computer screen while you're talking, it's the same thing at the bedside. We have to use electronic medical records, electronic charting of documentation of medication. We also have changed the technique that we administer nursing with the loss of the RN charge nurse. We've lost support positions like secretaries to take off orders, charge nurses to call physicians to get orders, phlebotomists to draw the blood. So all of these duties are falling back to the bedside nurse, while the number of nurses at the bedside falls and continues to fall. All of these things add to the workload of the bedside nurse, and all of these say to us that we need to address that grid. The nurses are struggling at the bedside every day to deliver the quality of care that their patients deserve, that your family deserves, that your constituents deserve. The nurses are burning out. The new nurses aren't staying. They're leaving. They're going to Syracuse where they can have 5 patients on their load, or 4 patients, or 6 patients at the most, where the staffing ratios are better. Management tells us that there's a nursing shortage and that they're having difficulty recruiting nurses to Auburn Community Hospital. And we say that better staffing ratios is a recruitment and retention tool that will solve part of their problem that they're having with staffing at the hospital. As Nancy said, multiple studies support that adequate staffing improves patient outcome, decreases complication rates, even decreases death rates. Adequate staffing means your family get better care, the care that they expect and deserve. Better nurse-to-patient ratios equals better care improves patient outcomes, better patient outcomes increase hospital reimbursement, and better staffing increases nurse satisfaction. In the end, it equals a healthier hospital. It's that simple. When we surveyed our members prior to negotiation to see what was most important to them, staffing was number 1. Not raises, not more time off, not more perks. These nurses are at the front line of healthcare delivery in our community hospital, and their voices need to be heard. We need your help with that. Please add your voice to our cause. Please remember our concerns in your interactions with Auburn Community Hospital. Thank you.
Good evening. I would like to thank the county legislature for allowing 1199 SEI Youth Union from ACH to address you today.
So, I'm sorry, can
Oh,
you name and address?
Yep, Kenneth Spurgeon, 318 North Loop, Auburn. So I realize that there are pressing issues facing this county, environmental, social, economics, so my remarks will be brief. We, the nurses of ACH, gather here today in this room and some outside. We're your neighbors, your friends, your relatives. We live and work in this county. We are the frontline goodwill ambassadors to people who seek care at ACH. Our goal here today is not to create division between management and the staff, but to create unity in our community to strive for healthcare excellence for the people of Cayuga County that seek it at ACH. The business model has previously been mentioned has changed dramatically since the inception of the staffing ratios approximately 10 years ago. The hospital has added several services: hemodialysis, interventional radiology with Strong Hospital, pain clinic, bariatric program, intensivist for the critical care area, a stroke center, and telemetry on every med-surg floor, to name just a few. The hospital also has acquired medical offices, gastroenterology, private practices, as well as the urgent care of Auburn that is in Central High, and is presently in negotiations for possible acquisition of the former Cayuga County Nursing Home. These are all welcome changes at ACH. We, the nurses at ACH, are excited for the future of our hospital and for our community. With that said, the acuity of the patients at ACH has increased dramatically. Since the advent of the guidelines 10 years ago, things have changed. The trend is to treat patients as outpatient as much as possible. Therefore, the patients that stay in the hospital are in most cases acutely ill, and in most cases needing significant care. The guidelines followed at ACH presently do not reflect that trend. There are national averages that are available to all to see. They're very easy to find. And they recommend a certain ratio for certain levels of care to patients to achieve the best possible chance to meet these patients' needs and have a positive outcome. The ratios are in place and followed in many, if not all, the hospitals in this region. Our proposal reflects similar numbers for ACH to bring us up to date with the current standards. We presently have been working more than 50% of the time below the guidelines established 10 years ago. More than 50% of the time we're short-staffed. In closing, I hope the legislature will see what the statistics prove and that the better ratios directly reflect a better patient outcome. And with the guidance of this legislative body, help ACH management to see the value and the quality it has in the nurses of Cayuga County that serve at ACH. For healthcare excellence for all, for us to seek. Thank you.
Thank you.
My name is Joe Malone. I live at 213 North Marvin. Some of you know me, most of you do here. President of Local 195 Auburn Police Department. When Kenny called me, obviously we're going to back a local union, 1199. So I just want to make a brief statement for our members supporting their members. A couple of points I took from them at retention. 3 years ago, our retention was awful. The morale will kill you, and you start losing quality people, you guys are going to have issues in that hospital, okay? I'm just telling you. That's what happened to us about 3-4 years ago, and we had to fix the problem. So listen to what they're saying. They wear many hats up there, those nurses. I work midnights, 4 to 12 days, you name it. I've seen it all. And we dumped some characters off to these guys. They're playing social worker, okay, domestic violence worker. They wear many hats, all right? Some people say, I don't want to do your job, Joe. Guess what? I don't want to do that job, okay? So listen to what they say. All right, our members came together with a little statement. I'll read to you, okay? We'd like to express our support of the 1199 as they bring attention to the growing need for stricter nurse-to-patient ratios in our hospitals. Our jobs share a similar quality in that safety concerns are directly related to staffing levels. As a police officer, nearly all of our training is based upon safety. And as professionals, we serve the public, we realize that safety isn't just about keeping ourselves safe, it's about keeping the people we care for safe too. The equation becomes simple. More nurses means better patient care. And although both of our jobs involve acting under situations of great urgency, we gladly accept that responsibility. We signed up for this because we all want to help. We all have the unique ability to act under pressure, and we all possess the desire to make people's lives healthier and safer. We understand and accept the fact that conditions are not always going to be ideal, and that a certain level of risk will always be involved as we provide our services. However, mitigating that risk and taking proactive and preventative steps to reduce the risk and improve safety and care is an option. We believe that the commitment everyone in 1199 made when they decided to become a nurse is unwavering. We know that despite low staffing levels, members of the 1199 give 110% every time they show up to work. We extended our support to them and joined their effort to raise awareness for their cause. Thank you.
I think we have one more speaker from tonight. Someone wanted to speak. Oh, never mind.
Hello, good evening. I'm Teresa Hummany of 6950 Owasco Road. I'm a member of the Ignite Steering Committee. Ignite is a group of young professionals with Cayuga County and a program with the Cayuga County Chamber of Commerce. And we are here to talk about the event that we're promoting called Ignite the Vote. We want to encourage as many people as possible to vote on November 7th. And so we are hosting an event at the Hilton Garden Inn on October 10th, where we're encouraging as many community members of all ages to come and hear our representatives. We will be having the city council candidates and the county legislature candidates come and answer questions, discuss their stance, their roles. We are having them each talk for about 3 minutes to explain their qualifications, and then we're going to have an MC that's going to pose questions and that sort of thing. We have an online survey that we're collecting various questions from community members that we will be able to funnel through during that event. You were able to get those questions through the Ignite's Facebook page. And we just want to really encourage everybody to vote on November 7th, and I appreciate the support that we have in our community. Thank you.
Are there any other members of the public who wish to address the body?
Mr. Chair, I just want to add one voice to the hospital issue. Paul Cedar, who was
Now we were going to have a discussion of that. If we can't do that so later, but that's not right now if we could. So are the public to address? In that case, the minutes. Do I have a motion?
Move them. Second.
Thank you. All in favor?
Aye.
Dr. Dre, you're up.
Thank you. Welcome to the friendly confines here at the college tonight. I appreciate the short commute. Good evening, everyone. I'll be relatively brief. We started our new academic year since the last time we spoke, and had a number of recent announcements and kind of accomplishments that I'll just want to highlight. Last week, you may be aware, the City Council here in Auburn announced with us a partnership for allowing us to bring our athletic teams in the area of women's softball to play at Casey Park is starting as early as this spring. But the bigger opportunity for us is for us to make an agreement to bring men's baseball to the college. College currently does not have a program in baseball, and we're looking to expand our offerings because not only do we think it's a great way to support a community interest that we know exists, but in addition to that, it's certainly something that helps us with enrollment and other future opportunities. So, not having facilities of our own, which continues to be certainly something we want to strive for, being able to work with community members like the school district when it comes to utilizing Holland Stadium when it's available to us for men's and women's soccer this fall, and certainly this opportunity with Falcon Park is going to be the only reason and the reason why we're going to actually be able to add men's baseball. So we're looking to make the formal announcement here in these couple of weeks because recruitment season for next year is upon us, and we want to be able to make sure we have adequate time to recruit student athletes to the college, but that actually won't take place until spring 2019, but we're looking to move that forward. Last month, there were a number of questions directed for me to talk a little bit more in detail about the enrollment of Cayuga County residents. And as our numbers get more firm for this year, which is really October, I will show you in presentation form, if you'll so indulge me, that I'll be able to show you a little more detail. But I wanted to really reflect on 16, 17, and 15, 16. We talked a lot in this body about FTEs, and the question came, well, how many students do you actually serve? How many students do you serve? So when we look back at 16, 17, for Cayuga County students when it comes to overall enrollment, the college served essentially 37% of our student body comes from Cayuga County, 37.68 to be exact. That's what, when you look at overall enrollment, that's what comes from Cayuga County residents and IEs from our sponsorship. It's very similar when you bring it down though, when you look at our head count overall student body, it's actually just under 33%. Well, why would that be? Well, because we talked a lot about FTEs here, and we talked a lot about FTEs at the college, but that's really just a metric related to budget financing. Head count wise, what we're seeing is that we have over 2,250 students in 16, 17 enrolled at Cayuga Community College from Cayuga County. And that number overall is just under 33% of our student body. So when we look at who we serve a number of municipalities. Certainly our sponsor is where we continue to make sure that we have, ultimately our focus and your support. But who we are really represents, nearly 64% of our student body comes from other counties. And that's a positive because that means we're attracting people from all over to take advantage of our offerings here in Auburn, Fulton, and online in our high schools and so forth. But it's also an interesting phenomenon related to who we are based on our demographics. The other big piece that's important, and you'll see this in detail next month, but I want to highlight it now in the simplest form that I can. When we look at last year, our total unduplicated headcount, and we look at our total FTEs. Last year, when we look at 15, 16, we ended up at FTE of 2669, full-time equivalent. When we look ahead to 2016 and 17, the year we just ended, at the end of August, we had an FTE of 2542. It's down approximately 4.5% overall. However, headcount-wise, we served about 90 more students. So when we talk about a college who maybe have been on decline when it comes to enrollment, when we talk about that often in a sense of the FTE or the budget factor, we're not talking about, really last year was the first year we had where our head count had increased from one year to another, regardless of the fact that we were down FTE in the neighborhood of 5%. So when we spin that forward to this year, we actually have budgeted a goal this year to be slightly ahead of where we were a year ago. And when we looked at that, I told you all last year, every month, I told you we were up 12% and 13% applications. Well, we've ended being up 9% in applications from last year to this year for our fall cohort. And we've also ended being up about 4% in enrollment when it comes to our new students. So that's not going to translate, and you'll see over time, to being up 4% this year because we were down in returning students a year ago. But the best indicator we can ever have as where we are today to where we can look for tomorrow is our applications up, and when you have applications up, are you capturing more students at the end of that time? And for this year, for new students, we have done that. Continue to focus our efforts on retention and so forth. But we also anticipate this year to have about 34% of our market share to be Cayuga County students, representative of that. And that, which means, we continue to focus a great deal on out-of-county students to be able to not only capitalize on chargeback opportunities, which help our overall budget, help our overall revenue, but certainly to make sure that we're serving students that we continue to serve. So I know that it would be easier in a visual form, but I know it was asked of me last month, and I wanted to be able to be more clear about that this month. Okay? In addition to that, it's early. It'll be more formal later on in the year, probably in December when we close out our audit process. But at year end, at this point, as I told you during our budget development process, we anticipated to end the year with having a goal of adding over $1.2 million to our college fund balance. And at this point, it looks like that goal will be reached, and if not exceeded, we're likely to be able to add to our fund balance close to the neighborhood of $1.5 million, which is there's no greater sign for an institution for us to be financially healthy, I think, and viable when it comes to really two things. Number one, you have a fund balance that ultimately exceeds the threshold that our creditors recommend, which is over 10%. This would do that. Actually, would bring our threshold closer to about 12%. And the other piece of it is that we're not living on our fund balance. We have created budgets the last 2 years that have been close to accurate, enrollment-wise, prediction-wise, which has resulted us to manage our spending accordingly, and has resulted in us to be able to reach our goals, which is to be able to get to the point where our fund balance is healthy. We have one fund balance, like you do, one fund balance, an institution with a long-term vision ahead, and we're also looking to make sure that when we create our budgets every year, we present them to you that you approve, consider that within reason, we want our expenses to only match what our revenues can produce. And that's been our commitment, that's been our trustees' commitment, and we'll continue to move that as we go forward. I'd be happy to take any questions.
Thank you.
Two questions.
Yep.
Full-time students 10 years ago.
Yep.
Where were we then on those numbers? Any idea?
I don't have 10-year-ago data in front of me, but I can tell you this. The biggest phenomenon that we face has been in 2012-13, Cayuga Community College demographics, the full-time to part-time ratio is 50-50. Today, our part-time student body is 65%. So we're serving more students. They're not taking as many credits as they used to. And part of that reason is multifold, because we have tremendous growth in the high schools, tremendous growth online, and those students, by definition, are not full-time students.
Second part, competition-wise with other than OCC, Finger Lakes and our college to the south, where are we, or how are we holding our own
From an enrollment perspective,
enrollment?
well, I can tell you this, across the state, essentially every community college, with maybe the exception of one, and none of those were mentioned, have been in decent decline in recent years. That doesn't mean that we're all proud of that, but demographic shifts, the economy improving, a number of other factors are there. I can't speak in detail about where they are, but I do know that they have been, institutions have been in decline. And I think the conversation we're having with trustees right now, not to make light of the question, is who do we think we are? Who are we? And what do we want to offer? Are we meeting the needs of our community? And ultimately, I think we're proving that the financial strength of the institution isn't necessarily dependent on the size, and that we need to be able to make our financial strength and our investments based on resources. And I think we've been able to prove that although we might be down 400 FTE compared to what Cayuga Community College was 6 years ago, I would argue that we're as financially healthy as ever.
Thank you.
Mr. Lattimore.
Mr. President, I support the institution. I'm an alumni of the institution. I was there Thursday night when you announced the baseball situation. If you notice when I walk with a limp because I had a soccer injury when I was playing here. So,
That's
I'm,
actually a limitation.
so I think it kept me out of the war, but, anyways, but you know my pet peeve is, we have a platform here, it's an NASA platform. We have a lot of weather-related issues. As you come in the building, you see the, you know, governance of the Institute of Application of Geospatial Technology at CCC. I want, if there's anything we can do to save that from going somewhere else, I would appreciate that. Because I think that that is a draw that nobody else has in the community colleges or even a four-year institution.
Any other, Mr. Didion?
Doctor, it sounds to me that the softball and the baseball program are going to be in. Would you say there's a good chance that's going to happen?
Yeah.
Okay, so my question is, what's the plan for student housing to take care of this? Because of the competition from past experiences of the college and of the area, there is a formidable foe, if you will, from these other schools that house people, and they're more apt to go where they could be housed and be comfortable, and instead of coming here and it's like a hit or miss, as the way I see it. Is there a plan to that fact?
There's always a plan. A couple of things to address your point. Number one, just to clarify, we already have softball. Our friends at Fort Byron have been housing our softball program for a number of years. This will just allow us to be able to find a field a little bit closer to campus in proximity. So that's not a new addition to our offerings. The baseball team is just clarified. I have made relatively no secret of the fact that with our trustees and with others, that at this point in time, I do not believe that student housing is the right choice for us. And that comes from a great deal of evaluation and insight. And I will tell you, I think we have a number of infrastructure needs, a number of programmatic decisions that need to be made in order to position us better for student housing. Athletics, by the way, I believe is one component of those, but one sport of potentially 25 to 30 student athletes is not going to necessarily be that particular answer. So working with our trustees, we are laying out a number of needs. Assessment. Part of those, by the way, are going to be a campus modernization plan. You know, we're sitting here on our campus, and I'll use the opportunity when we walk through parts of our halls, it's beautiful. But we also know that many of you will tell me that when you graduate from here, some of the facilities are the same. And I will tell you, talk about a marketplace of competition, we need to be talking about a marketplace where our facilities not only meet our student expectations of tomorrow, but that they can exceed them. And I'm not talking about needing to build more buildings necessarily or expand our footprint. I'm talking about repurposing the space that we have to meet our programmatic needs and to support our faculty in the way that we should be able to make sure that we're providing the tools for our students. The absence of being able to do that, the absence of having athletic fields to be able to have more offerings than what we can offer, the absence of being able to make sure that we can have the mental health services in place, that we can have the food services in place, that we can have the recreation and student life components in place, along with the most important one of public safety. Student housing, we're not ready for that. And so I know that may be some different news for others to hear, but the only way that I'll ever endorse, recommend, or support student housing for this institution is that we can make sure that we have all the other components in place to make sure that when students choose to live on our campus, we can give them the best experience that they deserve, and we can meet their expectations, that they're a safe environment that helps them be set up for their success. I think it could be something in our future, in our near future, but until we do some other work, we're not ready.
Mr. Dennis.
Listening to all that, if you're gonna bring in more sports, because you think it's gonna, enhance the college, if you look at the demographics studies of the surrounding schools in this county, look at the graduation rates. Yep. 40, 50. So if you're gonna have sports, you're gonna be relying on local kids then, because no kid's gonna come here from 300-400 miles away to play baseball and go to this college and have to rent an apartment or something if he can go to a college where they've got dorms. And so it's kind of a, I don't know. I mean, I can't see you having one without the other myself, when, if you're gonna just be totally relying on local talent. When local talent continues to dwindle more and more and more and more, and is going to continue to dwindle in this county. I firmly believe in 15 years, you're gonna see schools consolidated. You see them doing it now with their sports. So I think you're gonna see it for their entire student populations. So how will that work?
Well, I think a couple things. Number one, there are community partnerships that can be created to help support students live in. We've had a long history of athletics here where students are living in Latimer Hall. They are running apartments, do their things. I mean, there are students who will choose to do that. But also, you know, when you make a decision about something like adding a baseball team or any other athletic team offering, from my perspective, one of the main principles that you're looking at is what is the local interest? How does it align? If you look at recreation baseball in this community, look at high school baseball in this community within 30 miles from here, I believe there is rich talent that would like to be able to continue to play the sport and be able to compete at a high level. And by having this offering there, we'll be able to attract people from a distance. I also think we'll be able to attract people here locally. And it's no secret, many of you have actually told me that you know people that have chosen to go to other institutions because their chance to compete was not available to them here. And to go a step further, things like our theater program, our arts, our recreation, when you look at those types of extracurricular activities and offerings that can supplement the academic experience, those are reasons why students will choose one institution over another. So I believe it will be successful. I understand big picture, we need to look at both, but at this point, one team, one for 25 students isn't necessarily there. If we have the other facilities in place to be able to look at additional offerings, we're talking about potentially 150 new student athletes to this campus, then I believe the conversation of student housing is much different, but we're just not there.
Any other questions? Mr. Foley?
Dr. Durant, you said at one point that there's a need for infrastructure facilities before you can even consider housing.
Yep.
I guess while we are on the topic, can you just clarify some of the work that needs to be done in order to get to that point that you mentioned might be happening, or you're looking to do upcoming?
Yeah. So we've been working diligently internally for probably the last year and a half, to be honest, of trying to assess various spaces on campus, and really to try to think creatively about the needs today and the needs for 10 years from now. Right? It's not just today's moment. And we've challenged ourselves internally to know that the college demographics continue to shift. A number of students are online, they're on full campus, on Auburn campus, they're serving in the high schools. Brick and mortar needs evolve. And so we're really in a position now where we've been looking at the entire campus, particularly in Auburn, because a lot of the Fulton work is more recent, and to be able to say, perhaps how we think about this space. And I'll give you a concrete example. We want to be able to create a learning commons here in our library to be able to infuse academic support in typical library services. If we are to do that successfully, that's going to free up a significant portion of the building that now can be repurposed for sciences and STEM and other things, which is going to allow us to reduce the need for those in other places. So it's a domino effect that honestly, as you can hopefully appreciate, takes a significant amount of time to be able to put majority of that vision together and then to be able to roll it out in one. And I believe it's going to sound ambitious. It is ambitious. It's aspirational, but the failure of looking at something that's aspirational for us and for our community, I think is a failure of leadership. So if you'll just stay tuned a little bit, hopefully by later in this fall, we'll be able to roll out something more comprehensive.
Thank you. Any other questions? Thank you very much.
Thank you, I appreciate it.
Do we have committee reports or individual reports from legislators? Ms. McCann-Coleman?
I just wanted to comment on a few things. This month I attended the Water and Sewer kickoff of their comprehensive study. I'm a member of the Water and Sewer Authority. They're mapping and assessing public and private water systems throughout the county, as well as looking into a second source of water. I'll be updating this regularly. I wanted to say thank you to the Health Department and the Watershed Inspection Program for all of their hard work that they've been doing and will continue to be doing for the next few weeks. Thank you. That was my heard. It's specifically with communications and testing. I think they're doing a really great job and under these difficult circumstances. This Thursday is the Conservation Bus Tour that's being sponsored by the Soil and Water. I attended this last year and I'm hoping to attend Thursday, and I encourage anyone else to attend. It's a very informative tour and they do a nice job. And also the farms that we visit do a great job hosting us too. Lastly, I was honored to represent the county at the Fall NISAC Conference in Syracuse. I had the opportunity to moderate a panel on harmful algal blooms. Eileen O'Connor, the Director of Environmental Health, and Tony Casagiacomo of the Finger Lakes Hub presented. And I'm really pleased that NISAC included that topic into their fall seminar. I think it's proving to be very timely, as we've noticed in the past couple of weeks, about how many water bodies are being affected. And I think currently we have 65 water bodies in New York State that are facing harmful algal blooms. So I'm really pleased that they included that.
Thank you. Any other?
I'd just like to relay something. There's a committee being put together to look at possible areas to consolidate services and other type of things between the county and the towns and villages. I think you were looking for some highway superintendents possibly. The highway superintendent in Sterling has expressed an interest. He would like to be on the committee. Okay. Pass that along.
Thank you. Any other reports? Ms. Foley.
Just wanted to give a quick update. I know that Kevin Jones spoke at the beginning. I just for everyone's information, we will be looking at 2 law firms in order for the county to join in that lawsuit. This will happen in October's government operations meeting. I would encourage everyone to attend. It will be an executive session interviewing each firm separately, and we'll go from there. So if you have any interest in that, please attend, and we'll go from there. Secondly, I also attended NISAC. I thought it was a great event, as always. I went to the body camera workshop and listened to 3 of the sheriff's peers discuss body cameras, installing them in their deputies at their own facilities in their own counties. And I took away some very helpful information. I'll be reviewing it. I've already discussed it with Sheriff Gould, and I think maybe there are some opportunities there. So that about sums it up for me.
Okay, thank you. Ms. Ladner.
I'd like to just say about Eileen's thing. I have talked to Doug Selby 2 years ago in regards to having, in case we had a drought and now we're having algae bloom issues, we do need to have water systems in other bodies of water in case ours gets polluted or some other issues. So I think that that should be urgent.
Yeah, that's part of this discussion. Any other reports or comments? Mr. DeForest.
I also attended NISAC. I went to the 2 seminars on Raise the Age. One of them was basically the state's presentation on the rollout of the program, and the second seminar was the program from county's point of view. A lot of interesting questions raised at both of the seminars. The state, the main message that comes out of the state is that they are 100% behind this program, that they aren't going to shortchange counties on it. We all probably have reason to be skeptical of that, but they say that they are looking
down the road much further than just a 3-year timeline of funding. They couldn't give a lot of details on that, but the committee that was presenting said that this is long-term and that it isn't, they aren't going to leave people out to hang. The other part that was very interesting was hearing the various concerns that counties brought forward. And the state was very receptive to the input that counties gave. So we'll see where it goes from there. But it was very interesting and well worth attending.
Thank you. Any other reports?
Another point on the NISTAC conference is that Mr. Lattimore and I had the privilege of speaking with the new president, Mary Ellen Odell, and she requested to have her photo taken with us because she wanted to be closer to people from Cayuga County. So we gave her a lot of information on what we do here, and she was impressed with that information. So we'll follow up on that. Thank you.
Should have come tonight. Any other reports? Okay, thank you. So my report, I'll try to make it brief. I too attended NISAG in the, I won't repeat that, I think the sessions are very good. One of the things I will mention is one of the sessions I was in, it was with the director of the budget, and he specifically said that, and in response to a question, that the state is committed to funding Raise the Age program in perpetuity. So it's not for 2 years, 3 years, 5 years, but whatever the costs are forever. Now, what he didn't commit to is whether that means that there'll be funding pulled back somewhere else. So as we all know, that's the skepticism that we all share. But at least now the commitment is there. I spent the early part of this month in the final budget meetings with department heads, and that process moves forward. I still plan to bring a balanced budget to this group for consideration, and hope to have that on time. I can't remember, I don't remember the date, I apologize, but I will be sending out a calendar as I did last year with the budget dates. I'll be sending that out within the next week or two so everyone knows when the dates are, when the meetings will be. I met with the town supervisors to discuss shared services and highway issues. And I'll be meeting with the highway superintendents in October. This is partly a part of the shared services discussion initiative and partly a separate initiative, even though it absolutely applies to shared services. It's part of a larger discussion. For a number of years, we've moved in the direction of either contracting or in some cases, just sharing the maintenance of our roads, ditches, and bridges, and so on. And this is a continuation of that. The Cayuga Indian issue continues, but there is some change there. And I can't remember if I reported this last month or not. It was in my notes, so I suspect I didn't. But the Bureau of Indian Affairs has decided that Mr. Clint Halftown is the federal representative of the Cayuga Indian Nation. That was something we were waiting for. That was in limbo. That decision has been made at the BIA. There is still the likelihood of court challenge by the other group, formerly called Unity Council, and I think they may have a different name now. But that challenge will be filed in federal court in Washington, D.C. if it's charged, if it's filed. And so at this point, as far as I know, it has not been filed yet. I have an update tomorrow, so I may have some news on that. The concern with this moving forward is that because the federal government has now said that for purposes of federal relations, Mr. Halftown is the representative of the Cayuga Indian Nation. The nation has requested of the courts in Seneca County to evict the alternative group from the properties there. And so there's been a series of ongoing meetings to try to make that go smoothly as it possibly can. So that's the reason I mentioned it tonight. I'm certainly hoping that there's no repeat of the problems we had a few years ago, but we have no real way of knowing, and we're all staying very tuned to that, including the sheriff, the state and the league. we bid George farewell, and he's taking a job with the city. I know we all wish him the best. Terry Baxter is chair of the Public Works Committee, and Ben is the interim administrator liaison to that group, and management team. We've been talking about what we do. We'll have a recommendation on that very soon. We're looking at kind of a three-step process. What do we do tomorrow, immediately? What do we do in the short term, and how do we structure a longer term kind of response? So we'll be coming up with a recommendation on that very shortly. And I know it's not on the agenda, and my guess is the answer is not really. But George, you want to say a few words?
No, meeting's gone long enough.
But I think we certainly, if you could stand and at least accept our applause. And as a reminder, we will have our photos tonight. They will put some people in the back row, Joe, so that their legs don't show, even though I find them very attractive. I think it would be better if we had a photograph. And we'll do that. We do have an executive session, so what we'll do is break for the executive session, do the photograph at that point. I think that's probably the least time consuming and the least disruptive. So anyone have questions of me? Mr. Admiral?
Mr. Chairman, you brought up the Indian issue with Cayugas. We've had agreements and we did receive some revenues, 75,000 or something. Are we expecting those revenues with the change or with the recognition? I know that we receive other gaming revenues from the Oneidas, and we don't get some from the
We've never
Lago.
gotten gaming revenue from the Cayuga.
We are going to?
We've never gotten gaming revenues from the Cayuga. That doesn't mean we can't. But all of those agreements are with the state, not with the counties. That's an important distinction. I don't know if the state is pursuing any discussions with the Cayugas. What I do know is that it's not legal to share revenue from the kinds of, as a percentage or anything from the kinds of gambling that the Cayugas are doing in Union Springs. You just can't share that revenue. I don't know if the state has other discussions. Once that leadership issue is settled, we will begin discussions with them again. That has to be settled. It looks like it's moving towards settlement.
And in your absence last month, I did bring up some talking points. I think they're in the minutes in regards to some of the college issues. And I was hoping that maybe you could touch on those, maybe not at this meeting, but in the future.
Any other questions of me? Very good, thank you.
Communications and announcements?
Whatever. Motion to dispense with the reading of the communications?
Move.
Move second. Anyone object? All in favor?
Aye.
Thank you. I guess we're going to the resolution.
Yep, resolution.
Mr. Handful.
Mr. Chairman, I'd like to present regular monthly resolutions 1A, 1B. They've been both through committee and then also the monthly vote.
We have resolution of motion second.
Move.
Okay. Any discussion? All in favor?
Aye.
Any opposed? Thank you.
I'd like to offer WM1, that has also been through committee, and I offer that up for a vote.
Second.
Second.
Any discussion of this? All in favor?
Aye.
Any objection?
WM2, I know there was some discussion around that, this, as an added resolution to this meeting. It was added on the 21st. It was a resolution authorizing the cancellation of penalty and interest of $185.25 on tax map numbers listed here, and $93 on a separate tax map number. I believe there was some discussion by the treasurer of this. This particular resident has an impeccable record for paying their taxes on time. This person also had a record of paying these particular taxes. And so the treasurer felt that this was indeed the fault of the postal service. So I think that was the discussion you had in my absence.
And this, I was going to point out, this was approved by committee, it just wasn't. So, Joe, move. Second?
Second.
Any discussion on this? All in favor?
Aye.
Any opposed? Health and Human Services.
Mr. Chairman, I'd like to offer up HH1 through HH9 as a bundle. It's been through committee, and I offer it to this body for consideration.
Does anyone object to bundling these? You got a second to this motion? Thank you. Any discussion? All in favor?
Aye.
Any opposed? Thank you. Mr. Foley.
Mr. Chairman, Government Operations has 5 resolutions that have been through committee, ways and means. I offer them as a bundle here today.
Does anyone object to bundling these?
I'd like number 5 separated, please.
Okay. So the motion is then to bundle 1 through 4. Any objection to that? Okay, second?
Second.
Discussion? All in favor?
Aye.
Any opposed? Thank you.
Mr. Chairman, GO5 authorizing the clerk of the legislature to pay the Sunset Restaurant for Student Government Day lunches for students, school chaperones, and department heads and legislators. I know there was a little bit of discussion on the location. Maybe we can move it to a different location other than the Sunset Restaurant. I believe that was one that was discussed during the committee. The other was department heads and legislators, why we offer to pay for them. I think it's entirely reasonable.
Okay, well, if we're going to have the explanation is great.
Right.
But let's get a second so we can discuss it. There's going to be discussion.
Second.
Get a second. Now, is there discussion?
Yeah. Go for it. I think it's reasonable to do that, and I've been for that for a while, so if there's not anything.
Mr. Bennett?
Yes, I'd just like to go on record that from day one, when we decided to pay for department head and legislators, I've been against it. I figure it is not a mandated thing that any of us go to this, that it is an option, and when it should be an option that we have to pay for it, we should pay for it ourselves.
Any other discussion? Mr. Dennis?
I'm all for paying for the students and their chaperones, but I'm with Joe on the whole, we can pay for ourselves.
I've got 2 things. I agree with Joe and Andy. It used to be we paid ourselves. It was $12 or something, not a big deal. Every year I bring this up, so I'll bring it up again. We do Senior Citizen Day out at our own place at Emerson Pavilion. It's a nice facility. I have nothing against the Sunset or how they handle it. They do a great job, but we have our own facilities. I'm curious as to what the difference is cost-wise. If it's really that much of a difference.
Yeah, well, I want to point out 2 things, if I may address that. One thing is, this is a, in the case of no, I guess there's not much difference. And I'm trying to think, I was thinking different, that this was, I think that they did, that was priced. And it was, my memory is, our facility is much more expensive for some reason. But we'll look into that.
It is more expensive.
By law. But
Out of curiosity, who pays for Senior Citizen Day?
the county. Yeah, it's fine. Yeah. And we'll look into we'll have, I started to say something that's not the case, so let me check the cost differences, we can get that. Okay, are we ready to vote, or? So, all in favor?
Aye.
Opposed? So,
I'm abstaining.
Well, that's a no.
no, 2 abstentions unless there's an ethical or other issue. So do we need a roll call vote?
Sure.
what's 9 if he abstains. And that abstention, to be clear, an abstention in our system is a no vote. That's, if you're voting no. So who's voting no? Let me see if we need a roll call. 1. Grant, you
I can't, I didn't hear what you said.
Are you no or?
No, I'm yes.
1, 2, 3, 4, 5, 6. So it's 9-6. I think there's no 9-6 combination. So it passes. Unless someone wants a roll call, we'd like to roll call. Okay. Planning, Mr. Pinckney.
Mr. Chairman, planning has 3 resolutions. PL2 was pulled. I'd like to offer PL1 and PL3 as a bundle.
Anyone object to bundling these? In that case, do we have a second?
Okay.
Thank you. All in favor?
Aye.
Opposed?
Thank you.
Mr. Baxter.
Mr. Chairman, Public Works has 7 resolutions. They've all been through both committees. I would offer them a bundle, as a bundle.
Second.
We have a second? No objection to bundling. Any discussion? All in favor?
Aye.
Opposed? Thank you. Mr. Mahoney.
Mr. Chairman, we have 4 resolutions. I would like to offer them as a bundle. JP4 was discussed at both committees and revised after some additional information was shared at Ways and Means.
So does anyone object to bundling these? We have a second?
Second.
Discussion? All in favor?
Aye.
Opposed?
Thank you.
Thank you very much. Now, we do need to do an executive session. However, I would, before we make a motion for executive session, I don't want Mr. Lattimore to feel cut off. I think he had something to say related to one of the presenters, and I think the time to do that would be now under other business.
Okay.
Does he have a comment?
Well, I appreciate that because I have, well, anyways, Mr. Cito, who was a member of this legislative board for many, many years, his wife has been hospitalized for at least 6 months at Auburn Memorial, and he is in favor of supporting the staffing it more than less. So hopefully we can get the resources that they need in order to do that. Excellent, Chair.
Thank you. Okay, is there any other business before I entertain a motion for executive session? Mr. Baxter?
I just had a question, I guess, for you and Fred. A couple months ago, we passed a resolution to outfit 5 pickups with tracking devices. I understand the contract's still floating around somewhere. Nothing's been moved forward yet. Is that?
I'm not aware of that. I'll check that in the morning if you like, find out what
Okay.
the contract is and get back to you.
Yeah. I spoke with George earlier.
Okay.
He thought the contract was on somebody's desk.
Not on mine, I'll tell you that.
How do you?
Find out where it is.
Thank you.
Any other business before? So if we could do this, have a motion of executive session, and then if we could get our photos taken, and then we'll have the executive session. So
Motion to adjourn.
no, maybe second.
I tried.
Oh, can we have a second?
Second.
Jackson?